The entire Christian community and all our supporters from St. John's, the Evangelist Episcopal Church in Minnesota, I greet you all in Jesus' name. My name is Anthony Munene. I work for Give Us Wings as a program manager in charge of health interventions. I have been involved with Give Us Wings for over 11 years and I've worked in various capacities. My humble background at Give Us Wings has seen me work as a volunteer, an administrator, a cashier at St. John's Kayoro Health Center, a program officer health, and now currently working as a program manager health. Due to circumstances beyond my control, it is unfortunate that I could not join you physically during today's church service, which I was really looking forward to. I am deeply sorry for that. However, I am grateful for the opportunity to join you virtually and talk to you about how Give Us Wings and St. John's the Evangelist Episcopal Church continues to positively change the lives of vulnerable people here in Africa. 12 years ago, before Give Us Wings and St. John's the Evangelist Episcopal Church decided to construct St. John's Kayoro Health Center, the rural communities of Kayoro and other surrounding villages had great difficulties in accessing healthcare services. For example, it was a common phenomenon for pregnant women experiencing labor to give birth along the roadside or from their homes with the help of traditional birth attendants. Children below the ages of 5 years were dying from preventable diseases like measles, whooping cough, etc., due to lack of immunization services. People were dying from preventable diseases like malaria, which they used to largely attribute to witchcraft, among other difficulties. In general, conventional medicine was considered as the last option by many people, and the situation was very dire. Members of this community approached Give Us Wings with a request to build a health facility in addressing these challenges. Thanks to the partnership that Give Us Wings enjoys with St. John's the Evangelist Episcopal Church in Minnesota, this community dream of constructing a health center became a reality. In 2012, St. John's Kayoro Health Center opened its doors to the communities, and medical workers straight away began with the task of coming up with community-centered health interventions. For example, provision of community outreach services in medically underserved areas, provision of clinic days where doctors of different specialties are invited to provide medical consultative services, that is to say, gynecologists, pediatricians, general practitioners, provision of laboratory services, radio campaigns in a bid to providing health education services and create health awareness for the people. These interventions have seen an exponential growth in the annual client attendance from 400 people in 2012 to 32,000 people in 2023. To date, over 180,000 people have directly and indirectly been impacted. The long-standing relationship between St. John's Kayoro Health Center II and St. John's the Evangelist Episcopal Church in Minnesota has continued to flourish. Through continued engagement and support, St. John's Kayoro Health Center has been able to receive infrastructural development like the modern laboratory, maternity ward, labor suite, a modern kitchen, sanitation facility, purchase of a motorcycle, and other projects that have enabled the community of Kayoro and beyond to access quality and affordable healthcare. This infrastructure are a vital part in the provision of services and are greatly appreciated by the staff and the communities at large. Thanks to the continued support by Give Us Wings and St. John's the Evangelist Episcopal Church, St. John's Kayoro Health Center II, which was named in honor of St. John's the Evangelist Episcopal Church in Minnesota, continues to register the following successes. For example, every year, St. John's is able to provide immunization services to over 1,000 children below the ages of 5 years. Every year, over 400 children are born at St. John's, which we recently came to learn is a much higher number as compared to the biggest private health facility in Kayoro district that was established in the 1980s. Every year, over 10,000 people are reached in community outreaches that are medically underserved and now able to receive medical services. For example, laboratory testing, health education services, family planning services, deworming services, etc. Every year, over 800 people receive malaria treatment, and some pregnant women receive treated mosquito nets and prenatal vitamins to safeguard their pregnancy, among other successes. From the onset, St. John's Kayoro Health Center has and continues to strive to be a model health facility, providing unique health and medical interventions, not just in Tororo or Eastern Uganda, but in the entire country. Just to give you a quick snapshot of our unique approaches and valued partnership with stakeholders, in 2016, St. John's was identified as the best health facility in Tororo district in the provision of malaria services. This was after a rigorous assessment of medical records and reports from the community that showed compliance of the test before treatment policy. Support towards St. John's in the supply of malaria testing and treatment has increased ever since, which means that every client is treated after undergoing thorough laboratory tests and therefore improving health outcomes. In 2020, St. John's scored 100% on all its laboratory quality assurance assessments done by the Uganda Virus Research Institute. The assessments, which are done to selected health facilities in the country, seeks to assess whether quality of testing and accuracy of results are relayed to clients. To date, St. John's has continued to score 100% of all its assessments, which provides more comfort and assurance to clients that they're in good hands. In February 2024, St. John's was among 5 health facilities in Uganda that were identified for a USAID project with a focus on promoting and eventually scaling up enrollment of communities into our community health insurance scheme. The health unit was selected as an official government distribution center for COVID-19 vaccines and is often a distribution point for government distribution of malaria treatment and mosquito netting. All these are just but some of the successes from our unique approaches that speak to the interventions that St. John's Kayoro Health Center uses in ensuring communities are guaranteed with quality health services and makes us stand out from the rest. As I conclude, through the generosity of donors and well-wishers, Give Us Wings has and continues to provide life-changing interventions to vulnerable communities plagued with limited access to quality and affordable healthcare services, illiteracy levels arising from poor education, and limited capital to spur economic activities and programs. On behalf of everyone here in Uganda, and in a special way, I want to thank the entire congregation of St. John's, the Evangelist Episcopal Church in Minnesota, all our donors for their continued support, generous donations, and steadfast involvement in transforming the lives of the vulnerable people in Uganda. All the interested partners that are willing to join in this noble cause that Give Us Wings is addressing, we welcome you and are excited in walking this great journey together. I wish you all a great Sunday, and I hope that someday I will get to see you in Uganda during the volunteers trip. Again, very sorry I couldn't be there. However, I'm looking forward to coming over there and meet with friends who have since become family. Best wishes from all of us in Uganda, and may the good Lord continue to bless each and every one of you for your unwavering support and generosity. Thank you so much.